Hello. Hello.
Hello. Good evening.
Good evening.
Good
Hi.
evening. Good to see everyone. I think let me see. Yeah.
Okay, our time is on and we have to start so that we'll be able to meet up with our related time. So good morning, good afternoon, and good evening to all. Here in Nigeria, it's a pleasant evening. Depending on the zone you are joining us from. So I want to welcome each and every one of us to this meeting. To this meeting, the Work Health and Safety Committee, TORG-NG chapter is here to present on the needs assessment results discussion. So I want to welcome each and every one of us, and we'll try to be brief as much as possible so that we'll make it a bit, we'll make the discussion very interesting. So my name is Linda Sim Sharif. I'm a committee member of the Workplace Health and Safety Committee at TORG-NG chapter. It is my pleasure to be your moderator this evening at the discussion. So, and our topic that we're going to discuss today is the Workplace Health and Safety Needs Assessment result. It is with deep sense of appreciation that I welcome you all today to this important gathering. And I would like to begin by acknowledging many countries participating and represented here. Your presence and ongoing support for the funding chapter is highly appreciated. And your presence in order to see TORG go places, it's seriously appreciated. So for that, we acknowledge your presence. And then a special thanks also go to our chapters represented from different regions. Your support has been essential in allowing us to grow and thrive well. We deeply value diverse perspective and experiences you bring and enrich our discussion in decision making. At this time, I also want to acknowledge the broad range of professionals represented within TORG. We recognize and celebrate the wealth of knowledge and expertise that each profession adds to the operating room space and TORG at large. Operating room space, once again, appreciates your professionality, and we don't take it for granted. Once again, thank you all for being here, and we look forward to a productive and meaningful discussion. So next on our agenda, we have introduction of our officials, and then I am honored and humbled to introduce our able CEO and founder of TORG, who is in no other person than Adebusola Owokole, and the chairman of TORG Funding Nigerian chapter in person of Mr. Adeyemi Abdulateef. We also appreciate the presence of other TORG executives here present, both global and regional levels. I am also pleased to introduce the distinguished committee, which are in person of Mrs. Oluwatoyin H. Joseph. She's the chairperson of the committee. And we have Mrs. Temitope Malomodokumo, the vice chairman. We have Mr. Sunday Ekpe, who is also a member of the committee. We have Mr. Danjuma Aliyu, also a member of the committee, and my humble self, who is in no other person than Linda Sim Sharif. At this point, ladies and gentlemen, I want to I have the privilege and honor to invite our esteemed CEO, who is in no other person than Mrs. Adebusola Owokole, to deliver her opening remarks. Ma, please, the space is all yours.
Thank you so much, Mrs. Sharif. Same. Thank you, everyone. It's a privilege to be here and to be connected to this. It's an inaugural session for the committee, TORG-NG, Workplace Health and Safety Committee. And I believe the presence of everyone is valued today, and we are all going to contribute as much as we can, even though I understand that other chapters have joined this session. You are appreciated, and we believe that you are going to contribute to the discussion and or leverage upon any recommendations made tonight and make impact in your own chapters. I want to welcome everyone. I appreciate the committee, the chairperson of the committee, vice, and the members, and all the executive council leaders present from all over the world. I want to acknowledge and also appreciate everyone connecting. And thank you. I understand that people are busy, and there's a lot going on at the moment, especially this festive season. Thank you for honoring this invitation. Thank you for joining us. And thank you so much. And I look forward to having robust discussions with everyone. Thank you.
Our able CEO, thank you so much, Ma. We are privileged and honored to have you in our midst, and we seriously appreciate your knowledge that you always bring to talk in order to see that we succeed and go places. Thank you so much once more, Ma, for having you in our midst. So at this stage, we are set to proceed with the main agenda, and I'm privileged to invite our chairman of the committee, who is in no other person than Mrs. Oluwatoyin H. Joseph. She's going to handle the aspect of the presentation. So ladies and gentlemen, please let's be attentive, because our ideas, our contributions and comments will be highly appreciated. Mrs. Joseph, the space is all yours, pa. Mrs. Joseph, ma.
Hello, everybody. Good evening. I'm happy to be in your midst. It's my honor to present this need assessment results with you. And I want to appreciate all our international members. So I'm going to share my screen with you.
Yo.
Yes. Can you see my screen?
Yes, ma'am.
Yes, we
Okay.
can.
Yes, we can see, but it is too tiny.
Okay. Let me see if I can broaden it a bit. Let me see if I can broaden it. Can you see it now?
Yeah, it's clear.
Better. It's better, ma.
Okay. And this one also. So I want to welcome everybody. It's my privilege to be here. And as I've been introduced, I'm Oluwatoyin Joseph, the chairperson for Workplace Health and Safety Committee. And we are able to have a need assessment. So I want to share the results and analysis of this needs assessment with you. We have categories. The total responses are 75, and we have 5 subheadings, which includes general information, health and ergonomics, psychological safety and workplace environment, training and support, monitoring and evaluation. Now, let me go to the general information. Under the general information, we have gender. I'm coming to gender. So, no. I'm coming. No. Okay. Under the gender, we have our chart there that shows that majority of the largest percentage there is 74.7, which is female respondents, meaning that female respondents make up the majority at 74.7. And this indicates that, can you hear me? Hello, can you hear me?
Yes, ma'am, we can hear you. I'm just trying to share the screen from my end. I think it might be better that way if.
Okay, please
Yeah.
do.
Okay, because
Please.
of the time. Yeah.
Yes. Please share from
And
your.
I'll just follow your conversation so that I can know when to switch. Thank you, ma'am.
Okay, thank you very much. So we are talking about the gender. We have 75 responses, and we have female having the largest percentage of 74.4%. And the implication of this is that female respondents make up the majority of 74.7%, which indicates that most survey participants are women. And this high percentage of female respondents aligns with the broader global trend in healthcare, where women comprise a significant portion of the workforce, especially in roles such as, hello, that's okay, Satma. In roles such as nursing and allied. And this gender distribution indicates that workplace safety measures may need to consider gender-specific needs, especially given the high proportion of female health workers. The next slide, please. Yes, that has to do with the age group. From the chart there, the largest age group there is 46 and above, and 36 to 45 years have 40%. So meaning that between age 36 and 46, and 36 and above, altogether has a total of 84%, which reflects a highly experienced workforce, which has implications for workplace safety and development needs. And this set of people are seasoned workers that bring valuable expertise to healthcare settings, yet may benefit from ongoing training in updated safety protocols, ergonomic practices, and technology use. And these people are old workers. They face the risk of musculoskeletal issues. And that is why providing ergonomic improvements and body mechanics training can reduce the risk of this musculoskeletal problem. Then we should know that this age group are the ones that are trying to face the balancing of work, health, and family. So they will also benefit from stress management and resilient programs, which will especially benefit to prevent burnout. So the large proportion of other employers also highlights the importance of workforce planning, as facilities may need strategies for knowledge transfer and mentorship to prepare younger staff for future roles. Next slide, please. Thank you. Then we move to the Nigerian geopolitical zones. We have 6 geopolitical zones in Nigeria, which include North, Northeast, North Central, Northeast, Northwest, South-South, Southeast, and the Southwest. And from the chart we are seeing, we can see that Southwest has the largest percentage of respondents, followed by the not central. So the implication here is that regional disparities in workplace safety experiences and resource allocation across zones. Then we go to hospital facility, where we also have 75 responses. When we have these facilities as outlined, can you move out a bit? Yes, we have them identified as public hospitals. Move on, ma. Move up, move up, move up. Okay, thank you. We have them as public hospitals, private, and in the chart there, you see that we have them, the percentages depicted in different colors, and the one in blue has the largest percentage of 82.7%, and this shows that the majority of respondents are from public hospitals, which is 82.7%. And this suggests that findings primarily represent public sector's challenges, such as limited resources and high patient loads affecting workplace safety. Then I now move to section B, which is health and ergonomics. Here we have some questions to answer. One of the questions was, can you come down a bit, ma? Can you come down a bit, ma? Okay, the question is that, what are the primary physical health concerns in your facilities? And from the charts, we are able to see that musculoskeletal injuries is the issue that is shown on the chart as that is carrying the highest percentage of 58.7%, followed by poor workstation ergonomics, which is 45.3%. So this result underscores the need for ergonomic improvements, such as patient handling equipment and training on body mechanics. Then let's move forward to the second question. The second question was, rate the current ergonomics practices in your facility, such as safe patient lifting, workstation setup. We can also see from the chart that we have them in categories of excellent, good, fair, poor, and no practice in place. As for excellent, there is no respondent that click into that. As for fair, the prevalence of fair rating suggests that some facilities may have basic ergonomic equipments or guidelines, but this may not meet optimal standards or be consistently applied. In order to address this problem, facilities could enhance their ergonomic protocols, particularly around safe patient lifting and workstation setup, and providing regular training on the proper use of equipment, body mechanics, and workstation adjustment could significantly improve worker comfort and safety, and potentially reducing any of these risks we have mentioned. So for those facilities that have limited or no ergonomic practice, the priority should be to establish foundational ergonomic standards and raise awareness among staff about safe practices. Investment should be on equipment such as adjustable workstations, safe lifting devices, and anti-fatigue mats, which will improve ergonomic conditions. And there's also need for regular assessment, routine health and safety training that includes these ergonomic principles, which will ensure compliance. It will maintain safety standard and also address both immediate and long-term needs for a safer work environment. Can we move up to the next one, Ma? So the third question was that, what improvements, can you please come down a bit, Ma? Yeah, okay, that's okay. What improvements in ergonomic practices will benefit you most? So respondents were allowed to make their own suggestions, and we have such as safe lifting and transferring equipment, adjustable furniture, training of body mechanics and safe movements, regular breaks to reduce strain, provision of equipment to make work easier. So from our chart 2, we see that the blue color carries the highest percentage of 36. And the implication of this is that safe lifting and transferring equipment, which is 36%, and training on body mechanics, which is 30.7%, are the highest priorities among respondents, reinforcing the call for investment in both equipment and training. The next question was, of this, can we move up a bit, ma'am? This calls, the implication of this calls for investment in both equipment. Sorry. Okay, so this survey shows that a significant majority of 87% reported experienced work-related musculoskeletal injuries in the past 1 year. And this high rate of reported injuries highlights the urgent need for improved ergonomic practices and preventive measures. Facilities could benefit from investing in safe patient handling equipment, ergonomic workstation setups, and regular training focused on body mechanism and to prevent injury. By prioritizing these changes, healthcare institutions can potentially reduce the occurrence of musculoskeletal injuries, supporting both workers' well-being and their productivity. Can we move up, please, ma'am? Okay, we now move to section C. Section C has to do with psychological safety and workplace environments. And the question there is, have you or any of your colleagues experienced bullying, harassment, or workplace violence? Let's see the chart. Yes. 65.3% carried yes. 30.7% said no. And just 8% prefer not to talk. And the implication of this is that it indicates that 65.3% of respondents have experienced or witnessed bullying, harassment, or workplace violence. A substantial figure that raises concern about the workplace environment and psychological safety in healthcare facilities. And this is in contrast with 30.7% that reported no in their experiences, while 8% prefer not to disclose their experience. But the truth is that the high percentage of reported incidents underscore the need for improved policies and practices to prevent these behaviors and ensure safe work environment for all employees. This same high rate indicates potential gap in effective anti-harassment policies and enforcement. So facilities will benefit from comprehensive policies that define unacceptable behaviors, that outline clear reporting procedures, that enforces strict consequences for misconduct, and ensuring consistent enforcement of these policies, which is essential for fostering a respectful workplace culture. So leadership training on conflict management and psychological safety can play a vital role in addressing this issue we have mentioned, and empowering managers to handle incidents effectively and to foster inclusivity can positively influence the workplace culture. And this can provide support systems such as counseling, peer support groups, and mental health resources, which is crucial for employees affected by these incidents. And regular monitoring of workplace culture through survey feedback mechanism can also help track effectiveness of policies and identify areas for improvement, creating a safer and more supportive environment for all staff. The next question to be answered is, what are the main psychological concerns in your facility? Our chart also shows that in multicolor, the purple color has the largest percentage of 62.7%. And these psychological concerns are highlighted as bullying, harassment, discrimination, workplace violence, stress and burnout, lack of support from leadership. So according to this chart, stress and burnout, which is 62.7%, is the most reported issue, while lack of support from leadership is 13.3%. Both of them appear significant. Support. We move to the next question. The next question is, what support systems are currently available in your facility to address psychological safety? Well, we have a total of 37 respondents. And from the charts, the implication, we have a reporting mechanism, counseling, harassment, and violence policies. And out of all this, we can see that emphasis on the reliance on reporting mechanism carries 32.4% as the main support tool, followed by counseling service of 18.9%. And we can also see that with 24.3% of respondents indicating none, shows that there is gap in psychological support system across facilities. Our next question is, what will help improve psychological safety in your workplace? We still have our charts, and from the charts, you can see that with the multicolors, we have the green part carrying 33.3%. And we have the anti-bullying and harassment policy, clear reporting mechanism, confidential psychology support, leadership training. What is the analysis of this percentage? The leadership training on conflict management, which is 33.3%, and confidential psychological support, which was 22.7%, are frequently suggested solutions. And as illustrated in the chart, this reinforces the need for improved management skills and accessible mental health resources. We now move to section D, that has to do with training and support. What kind of training will be most helpful in improving workplace safety and health? With the response from 75 respondents, the orange color of our chart, of the multicolor chart, shows 34.7%, which happens to be the highest. So this shows that a strong interest in several types of training to enhance workplace safety and health. And with 34.7% identifying stress management and resilient training as the most beneficial. This high preference suggests that healthcare workers face considerable stress in their roles, highlighting the need for training programs that help staff manage pressure and build resilience to avoid burnout. Then we have communication and leadership skill, which is the second one that carries 22.7%, shows that effective communication and leadership are critical in creating a supportive and safe workplace, as they can enhance teamwork, prevent misunderstandings, and empower staff to handle conflicts constructively. With 20% of 15 respondents indicated a need for ergonomic training. This will focus on patient safe patient handling and injury prevention, addressing the physical demands of healthcare work and reducing the risk of musculoskeletal injuries. Then we have those who opted for psychological safety training. This one include anti-bullying and conflict resolution. 14.7% was allotted to read, while workplace violence prevention was chosen by 8%. So these preferences emphasize the importance of creating a workplace culture where employees feel safe from harassment and violence. These insights reveal a comprehensive need for training across multiple dimensions: physical safety, mental health support, effective communication, and protection from workplace violence. And these are aimed at creating a safer and a more resilient work environment. The next question is, would you be interested in attending workshop or training session organized by the TORG-NG Workplace Health and Safety Committee? The chart shows us an emphatic yes, because 97.3%, that is 73 out of 75 respondents answered yes. What is the implication of this yes answer? It is overwhelming, and it is interesting to know that workshops and training sessions organized by TORG-NG Workplace Safety and Committee will be attended by 93.7% of those who express a clear yes. And none of the respondents selected no. So which means everybody supports this workshop and training, while only 2.7% are neutral. So it reflects a strong desire among health worker staff to engage in professional development opportunities focused on workplace health and safety. And this enthusiasm from our respondents suggests that healthcare workers are aware of and eager to address workplace safety challenges and to prevent injury. So TORG-NG has a valuable opportunity to meet this demand by offering targeted workshops on these topics. Structured training sections could provide both practical skills, knowledge that would help staff manage daily risk more effectively and foster a safer work environment. So by organizing regular training sessions, TORG-NG can also strengthen its role in promoting workplace safety culture across facilities. Engaging staff through this session will not only improve safety practices, but also build a sense of community and support. The strong interest in attending workshops indicates that staff may be more receptive to further safety initiatives, fostering a proactive approach to health and safety in healthcare settings. Now, the next question is, are there any existing gaps in workplace safety training in your facility? We still have our 75 responses, and we have specific issues mentioned. People were given opportunity to mention specific things, and they carry 69.9%. So the majority of responses indicate gap in safety training, with 21.9% directly acknowledging the need for improved training, and 69.9% citing specific training issues, such as limited resources or inadequate orientation. And the chart effectively highlights a widespread need for structured and consistent workplace and safety training. So we move to section E, which is the last but not the least, which has to do with monitoring and evaluation. The question there is that, do you feel that your facility regularly monitors and evaluates workplace safety practices, such as injury reports, risk assessments? Well, we have our yes, no, or not sure, and we can see that no carried the highest percentage with 35 respondents. 46.7% said no. So this result shows that 46.7% feel their facility does not regularly monitor and evaluate workplace safety practices, while 26.7 believe that safety practices are monitored, and on another 26.7 are not sure. So this suggests a substantial gap in either the feasibility or effectiveness of workplace safety evaluation, as nearly half of the respondents perceive a lack of regular monitoring, and over a quarter are certain about whether such a practice are in place. They are not sure. The high percentage of no indicates that many facilities may not have consistent or transparent procedures for tracking safety practices. And regular monitoring is essential to identify these risks and implement preventive measures, which can significantly reduce workplace injury and improve overall safety. The uncertainty among respondents may reflect inadequate communication about existing safety evaluation or lack of clear safety protocols. In order to address this concern, the facilities could benefit from visible and frequent safety assessments, which include clear communication to staff about these efforts, implementing standardized injury reports, regular risk assessment, and sharing the outcomes with employees will enhance awareness and demonstrate a committee to workplace safety. So this approach will also build trust among staff. And then we move to the next question. What improvement would you suggest to enhance workplace safety and well-being in your facility? We have a lot of them: training and education, equipment and resources. Can you put it up? Yes. Leadership and communication, staffing, workload management, health and well-being initiative, policy and monitoring improvement, then miscellaneous. So from the category, we see that training and education has the highest percentage. And this shows emphasizing regular comprehensive safety training. Next. And the equipment resources, which is 17.3%, and leadership and communication, 13.3%, are also significant areas where respondents believe improvements can enhance workplace safety and morale. So this chart shows the need for balance on this part. How does your facility review and update workplace safety policy and guidelines? Is it monthly, quarterly, annually? So we can see that from the chart, I don't know, carried 46.7%. So this indicates that because it indicates that they do not know how often these policies are reviewed. And 16% say that their facility lacks any safety guidelines. 17.3% believe that reviews occur rarely or never. So this suggests that many facilities may either lack formal processes for updating safety policies or fail to communicate these policies to staff. Can we move on? So we now have additional comments. The respondents were allowed to make their own additional comments, and these are the comments we have with the frequency at which they occur. We have training and development needs. So the summary is that emphasis on continuous training, particularly in leadership, communication, and stress management. Policy and regulation. This concerns regarding the need for structured policy at government and institutional levels to safeguard workplace health and safety. Then supportive work environment calls for an inclusive, respectful, and supportive work environment that addresses mental health and providing counseling. Occupational health and safety suggestion and trade on need for improved occupational health and safety practices, PPE usage and anti-bullying policies and burnout prevention measures. Then specific suggestions. These include the infrastructural improvements and flexible work options to support staff well-being. Thank you very much for listening to me. And I know with this presentation, it is going to serve as a stepping stone to many of us who are here, that we can build on to ensure that we encourage workplace health and safety in our facilities. Thank you for listening. I appreciate you all. Hello?
Oh, we can't hear you.
Ms. Sheriff,
Welcome,
first of all, I must say that was a brilliant presentation. Thank you so much, our honorable chairperson, Workplace Health and Safety Committee, TORG-NG. Thank you for doing justice to that. Thank you for all the efforts. And I must say thank you to all the committee members as well for their role in advancing research and in coordinating even this assessment, and for doing great justice to the assessment that has just been shared to everyone. I believe it's very obvious there is a need. There is a need, and the need is so significant. There is a huge gap in training, in awareness. Sorry, may I ask everyone to mute? I think there is noise in the background. There is significant disparities in terms of gender, in terms of region, in terms of hospitals, especially as we saw that most of the respondents were from public settings. And the primary concern that was flagged in the assessment was related to musculoskeletal problems and bullying and different things that go on in the workplace that doesn't make the workplace safe for employees. A lot of issues has been flagged, and I believe that the assessment was just a step, and we need to build more on that and ensure that we put a lot of things in place. I think before I continue, I might just want to invite one or two people, if you've got recommendations, if you've got any comments on what has been said so far, or if you've got a word of advice for the Workplace Health and Safety Committee, or if you want to just say something, or any comments, questions, queries, you are welcome. You can unmute your microphone. Any comments, any recommendations? If you unmute, kindly introduce yourself as well, your location, and maybe your zone. You may not necessarily mention the hospital name because of privacy. I could see a lot of comments in the session. Someone said, well done, ma'am. Someone said, brilliant presentation. Someone said, very nice presentation. Someone said, it's very educative presentation. Okay, may I just invite the vice chairperson of this committee for our comments and recommendations, Mrs. Malomo Dokumu. Kindly unmute.
Yeah, good evening, everyone. I really want to appreciate my able chairman for a brilliant presentation. Thank you. Well done. My little contribution is that this presentation, according to the statistical reports, mainly affected Nigerians, precisely because in most of the hospitals in Nigeria, we don't have patient lifter and some other things that we needed that make the theater personnel to usually have musculoskeletal injuries and some other things. And personally, from the office of the NAPON Association of Lagos State, we've met with the First Lady of Lagos State, Dr. Mrs. Sanwo-Olu, to put those things in place in Nigeria, because we've gone around the hospitals in Nigeria, both in federal teaching hospitals as well as in state hospitals. We don't have all those gadgets in place. And that is the reason why majority of the operating room personnel usually have musculoskeletal injuries and some other bone problems. So we implore the work safety committee from TORG to peradventure, if they can help us to write a letter to the state government to support what we've already, started working upon, so that at least this one can reduce the pains of the operating room and reduce the health issues on the operating room. Thank you very much, ma'am.
Thank you so much for the wonderful contribution. I believe it's a significant challenge across the country and in most low and middle income countries as well. Maybe someone from another country can tell us what's obtainable in their country, or how issues like this started in their own facilities and how they overcame that issue. If anyone has got recommendations from there is a need to go to government level to support what existing organizations have been doing in the country, and build up upon that. And maybe it will carry more weight, let me put it that way, if the committee can also help in writing official letters or maybe sending representatives to the government as well. I think that would go a long way. And at this junction also, maybe there is a need, since the committee are only 5 members at the moment, I think there will be a significant need to expand the committee, maybe have representations from different geopolitical zones in Nigeria, and with key stakeholders that can help even to bring things into reality, to influence policies as at government levels and more. And especially if there is no patient lifter, that is a challenge. That is a significant challenge, because as we all know, the operating room environment, people stand most times, they lift heavy equipment. I could remember maybe they haven't, well, maybe this wasn't in Nigeria anyway. I could remember when I first got to Ireland, my first hospital, there was something that the CSSD was doing, because there was one day, there was a revision case whereby they opened almost 30 trays, if I could remember. And because the staff involved was significantly sick afterwards, so they started putting weights, the amount of weight from CSSD. So once the tray is processed, they put like the number of weights of that instrument tray, they put it as part of the tag on the instrument. So eventually a scrub nurse or anyone scrubbed for the procedure, carrying trays and lifting trays, transferring one tray from one trolley to the other, could end up carrying almost 100 kilos for one single single procedure, which could be detrimental in the long run. So there is a need to fill that gap in terms of maybe contacting companies that have the patient lifting equipment at affordable rates, and we could liaise with them if they can have it on trial. They could release, maybe facilitate trainings and give trial products that people can try out and give recommendations and evaluate and say, okay, maybe the CMD of the institution wants that equipment to be retained and more. So we could liaise with company representatives that deal with patient lifting equipment, or that could help to facilitate training, or even if it's going to the level of partnership for TORG Global, if it's going to the level of partnership, I think we might need to look at that as well. So thank you so much, Mapo. That's wonderful contribution. May I also call one of the, let me see. I think I could see Mr. Danjuma Ali is one of the committee members. Can kindly unmute and give a recommendation or say something if that's okay.
Okay, good evening, everyone. Just like the chairperson have said and the chairperson have actually recommended, there is a kind of disparity between the therapeutic nursing practice in Nigeria and then compared to developing countries. In Nigeria, I think from my experience, have not seen patient lifting device before. So I think it will go a long way if such devices are made available in Nigeria to help in facilitating our responsibilities in the OR. Thank you very much for joining this discussion.
Thank you so much. Thank you for the wonderful contribution. In fact, it's now obvious that there is a need for training, there is a need for equipment, there is a need to influence policies. I could say in the comment section that in some of the private facilities, they have the lifting hoist, but it's either it slows down work or most nurses or healthcare workers lack the necessary knowledge to use that. So training will help solve this problem. So there is a need, that's a priority goal for 2025, maybe have one workshop or one workshop every quarter or every 6 months or something, a training that is related to workplace health and safety. Definitely, we are going to look into that. I think, can we have someone from another country, if you would like to let us know what is obtainable in your country? Alexis from Rwanda, are you free to give a recommendation or share what's obtainable in your country so we can know? I think I could see someone from Ghana also. Newton, can you unmute and say something? It could be late at people's end. Mrs. Bifari, have you any recommendation or suggestion? I think it's okay. I think someone. Okay, Christian, thank you so much for raising hand. Yeah, thank you. You're welcome.
Thank you so much. I have been in a government facility for over 21 years. Recently, things are changing. There are programs in some of the universities for occupation and safety management.
Sorry, are you in Nigeria or?
I'm in Ghana.
Oh, Ghana. Okay, thank you.
Yeah. So I'm in a government facility.
Okay.
Yeah. So I remember I was given anesthesia. I'm an anesthetist in a way.
Okay.
I was given anesthesia to a patient that had hepatitis. So luckily for me, I was wearing three gloves, sterile gloves. So the needle couldn't hit me per se, but I was scared, and I went to the safety and occupational and safety manager, and I have to go to the HIV unit to do go through the process, and I went for the hepatitis B test as well. I've done that for about 3 times now because they asked me to come continuously. They've given me schedule to do that. At a point, recapping of contaminated sharps especially the needles, became so much alarming. Inexperienced people try to cap the needles with the cap in their hands. So some of them were getting pricks and all this. So quickly the occupational and safety manager has to come in and address all those. So there are procedures that we follow when those things are happening. Concerning the lifting techniques, there are rollers some of the hospitals have. You can use rollers to roll the patient, or the bed, some of the bed are adjustable. So you can adjust them and the patient will turn to the trolley or the bed that you send the patient to the recovery. So it's hello.
Yes, please.
So it will be a good thing for us when we all have them in our institutions, so that safety can be our priority. We are all growing. The musculoskeletal challenges are propping up. Our waist are paining us. In fact, so we need to go through the safety training all over so that we can be safe and continue our work. Even on retirement, we can go on retirement safely, not with challenges. Thank you so much for the opportunity.
In fact, very valuable contribution. Thank you so much. We almost forgot about the fact that needle stick injury is a significant and often overlooked workplace issue, and staff need to be trained. They need to be trained that needles are not to be recapped in whatever way. And if possible, those facilities should have the safety devices, syringes that have automated safety devices, if they can afford that anyway. Thank you so much for that wonderful contribution. As you mentioned, I'm not sure if they've got adjustable beds in Nigeria. I'm not sure now. Maybe someone can let us know. And I could also say in the comment section that the importance of training can't be overemphasized. I work in a teaching hospital and I haven't seen.
We don't.
Ma?
I said we don't. I have never come in contact with any.
Okay, wow. I haven't seen any lifting equipment for neither
Actually,
patient.
we have it here in Nigeria, in my hospital here in Damaturu, that is Yobe State. Thank you.
Yobe State. Is that a teaching hospital or private, or?
Yes, indeed, it's a teaching hospital.
That's amazing. Your managers must be technologically oriented. Unfortunately, thank you for that. Unfortunately, it's heartbreaking to see that most of these things are lacking, even in teaching hospitals. I'm not sure if it's the priority of the government that is not on health care system, but we can change it as in bits. We can do our own part and focus on awareness, focus on trainings, workshop. And since we work at grassroots levels, and most of TORG members, they have direct contact with patients. And I believe if we facilitate training and retraining sessions and focus on that, we can improve a lot of things and gradually influence policies. And at the same time as well, I think one of the questions in the statistical report was talking about the fact that there is no monitoring and evaluation of workplace health and safety assessment in place in most facilities. I think TORG can also, this committee can create like a template that hospitals can adopt and use for their own staff, assess what they need. Maybe it can be presented at a faculty meeting with multidisciplinary staff and the results, and then they can see how to come in. Even these results, we are happy to share that if facilities will be willing to present that to their hospitals. And at the same time, I think to give it more visibility, it's not going to end here. We need to publish that result in reputable journals and see how we can influence policies at the government level as well. So thank you so much. I think someone else wants to say something. Azan, is it?
Yes, good evening. Good evening, ma.
Good evening, ma.
Yeah, this is Mrs. Bifani. Sorry,
Yes,
I joined late, just coming from another meeting. I want to appreciate the organizers and especially our chair. You are highly appreciated, ma.
Thank you, ma.
So my little contribution is that we should, if this manual lifters we have in a few of these areas that we can still manage pending the time we have the appropriate one. So we can recommend to the management to get, I mean, half a bread is better than none, pending the time we have the food one. So we can get, like where I retired from, they have these manual lifters that they use, and that help a lot. So be it as it may, I want to suggest that people manage workload and stress. Let's take a break. Let's have rest, because I found out here, especially in this our area, we don't rest. We want to work, and we have multiple roles. Some of us are still going back to school. We'll come back to work and back and forth like that. So we have to manage the workload, and we need to take rest and get recharge. And the training, we cannot but continue to attend them training and stay updated on these issues of patient safety and nurses safety too. And when we have issues, I think we should encourage ourselves to seek medical advice in good time before it gets too late. So if the back pain persists, we should consult and then get appropriate treatment. That's just what I have for now. So thank you so much.
Thank you so much, ma. In fact, we are focused on the injury aspect, which is really good. Rest is important. If any issues with health, musculoskeletal injuries, there is a need to seek medical advice and not just sit at home or keep working on. In fact, even people traveling out, it has become a problem because they work, and many are just dying. If you've been reading the news, it's not always about work, or it's not always about money, and things like that. There is a need to rest and just know that, oh, my body is getting to this breaking point. I just need to stop now. I mean, because I think from the last conference, we got to know in Nigeria that some facilities are actually doing multiple 24-hour shifts in a week, multiple 24-hour shifts, and which is way too much. I understand that there is staffing issues in the country with people traveling out here and there, and the younger generations, they want to go outside. Well, for me personally, I would say that I want my country to be better, because if the home country is better, what are we going to be looking for in other people's country where we are not even really valued? You have to prove and walk your way to the top. You have to walk your way to the top. Like, so if I want to personally talk about what I've faced, I think for 1 year, I will still be on that. Because unless you struggle and walk your way to the top, one is never going to be valued. And whereas if our country is better health-wise, we should be inviting others to the country and not all our healthcare staff, doctors, nurses, healthcare workers. The schools are just training them for other countries. That's just the way I see it, which is not meant to be so.
Yeah, sorry.
Yes, please.
Actually, okay. Actually, this issue of brain drain, it's a kind of a global issue, not only in Nigeria, but specifically we in Nigeria. If you consider our health system, it's not been what should I say? It's not been pampered well or considered to be well furnished with equipment and the rest. All the things that should be provided are not provided. The manpower are still less. Always, that's how it's been happening. So, and you've not been compensated for what you've been working. You might work for like 2-3 staffs, you alone. How? I don't know how to even express it. You will only be in a ward with maybe 32 patients, and you are the only staff on the shift. How will it happen like that? How will you even deliver a standard healthcare to patient? For example, we in the preoperative section that we are practicing in the theater, you will scrub for like 5 patients, 6 patients, 7 patients, you alone. Actually, it's not in our own standard of practice as perioperative nurse, but that's how it's been happening. And if you go to other countries, you practice the ideal thing. That's why most of our staffs, most of the healthcare staffs, you always go for other countries to practice. You will practice, you will gain your skills, and you will deliver what you are supposed to deliver, and you will still be in your good health. But if you keep on staying, like if the healthcare system it's not properly taken care of, it's not properly considered as a priority by the federal government or the state government to be taken care of well, this brain drain will continue to be happening actually. So the thing that we can do as under this our global forum, maybe I would suggest that we can maybe develop a kind of operating room protocol, a standard operating room protocol that we might use to be having a kind of seminars or training based on that protocol that has been designed and be using it, I guess. Thank you.
Thank you so much for that wonderful contribution. May I ask, where are you based again? That's in Nigeria, right? Yobe State, you mentioned.
Yeah, actually, I'm in Yobe State in Nigeria.
Okay, thanks. May I just use this opportunity, if the committee is happy with this decision, may I just use this medium to invite you to join the Workplace Health and Safety Committee. There's a need for a secretary and PRO on that committee. Would you be able to join? Would that be convenient for you?
Yeah, actually, of course, but I have to see the roles to practice
Yeah.
roles to carry before I.
Absolutely, we can do that in the background, and the chairperson can reach out to you as well to tell you more if it will be convenient for you. You might want to consider that because you have the passion and the go and you have the knowledge and competency that we want in that committee. If you understand what I mean, reaching out, developing policies, and more, because we want people who are passionate about the country. Because for me personally, some people would say, oh, why are you still involved in things in Nigeria? And even though I've left the country for some time now, I want to see myself coming back home to develop the healthcare system of the country. That's my goal. That's my priority. And hopefully it will happen. God will give us the grace. It will happen.
Indeed, yeah. Actually, even if you've traveled to other countries, if you've been practicing in other countries, once if your country is doing well to its healthcare system, and you will be getting what you suppose, even if not to the to what you are getting currently in other countries. If you are compensated well, you will love to come back to your countries in order to help your people.
Absolutely.
But going by this, we are the current situation that we are in this our country. I don't know how to even express it. It's actually not sympathizing. We are being drained without like should I say appreciation or something like that. Just been used, not.
Thank you so much. I'm sure you have more words to say, but unfortunately, we are now out of time. Can I invite the chairperson of the committee if any recommendations, next steps, or way forward? Mrs. Oluwatoyin Joseph.
Thank you very much, the CEO, for your contributions. And I want to thank everybody for the contributions you have made. This is highly appreciated. And you have boosted our morale. And because we are positive and result-oriented, we will do our best to leave a landmark and make sure we rekindle people's knowledge about workplace health and safety. So thank you very much. Well, for our way forward, many of what we have reviewed are what we are going to work on. So we are going to work on them. We want to see how we want to arrange for seminars, workshops, conferences that will deal with many of the things we have discussed in order to reduce pain, in order to help us maintain our mental stability, to be emotionally stable, to be free from fear in the working environment. So with this review, we are going to sit down again as a committee and see how we are going to work on them and ensure that we disseminate, we create awareness and escalate all of this that we have put together and the contributions that have been added. Come 2025, by God's grace, we are going to work on them. And we know that if we come in contact with obstacles, we have the backing of TORG community. We have our leaders, we have the CEO, so we are not going to be hindered by any challenge. When we get to the river, we will cross, but we are going to start, and we are starting well. Thank you very much.
Thank you so much, ma. Thank you very much, ma. At this junction, I must say a million thanks to everyone, to all the executive leaders of TORG, to the committee, Workplace Health and Safety Committee of TORG Nigeria chapter. I want to say thank you to all chapter members that connected from all over the world. Thank you for your valuable contributions. Thank you for taking the time out of no time even to join this session, despite the fact that it's for another country. You still joined, and we gained one or two things from the recommendations as well. So I must say thank you to everyone. And in the next few weeks, I think we might be rolling this assessment across to low and middle income countries so that we can have a broader range of responses across multiple countries in Africa and actually know and compare and contrast if it's obtainable more in this country or if it's not, or how we can leverage upon knowledge and share expertise across multi-countries. So thank you so much, everyone, for joining us. I believe in the new year, there is going to be more training workshops organized and in relation to workplace health and safety. And I must say, Merry Christmas or Happy Christmas, depending on what they say in your country, and wishing everyone a Happy New Year ahead. Thank you for joining and have a nice day. Bye. Bye-bye.
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 Thank you. Bye.
Bye.
This session is recorded. Thank you, everyone. We share. Thank you. Bye. Bye-bye.
Bye. Thank you, everyone.
All right. Bye,
Bye.
everyone. Thank you very
Thank
much. I'm
you.
grateful
Thank you.
to
Bye,
have
everyone.
Thank you.
Bye. Bye-bye.
you.